Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today, our guest is Corey Oshikoya, and he's joining us from Arizona. He is an athletic trainer who's passionate about bringing awareness to the role that social determinants play in how athletes recover, perform, and have access to care. We'll unpack what social determinants really mean in the context of athletic training, from socioeconomic barriers and cultural differences to school funding and mental health access, and discuss how a deeper understanding of how these factors can make us more effective clinicians, advocates, and educators. So welcome to the show, Corey.
Thank you so much. So glad to be here. Appreciate the invitation.
Well, we just met a few weeks ago in Omaha, Nebraska at the BOC headquarters. So I was trying to connect people on how I met my guests. And that was an awesome time over the weekend-ish. Going through the practice analysis. And while we were talking about it, you have to remind me, what were people getting confused social determinants with vocabulary-wise when we were going through the standards of practice?
I think in the practice analysis previously, there were some things that were listed as psychosocial needs. Maybe there wasn't even patient values in there, but I think it was the term of psychosocial needs. And so people were like, well, maybe it's social determinants of health. And then I think I ended up having to be an advocate for the social determinants of health because I don't know that a lot of people had a really good idea and concept of it.
Yeah. Well, I was glad that you brought up the difference because I think everybody was combining it all together when, those are really separate things ultimately, and how we deal with it and approach it in the athletic training world. So I'm glad that you brought that up, and that's why I wanted to have you on the show to talk more about it, because I know that we talk a lot about it, but I don't know if I'm sure you do it in your program, but it didn't seem like we really hit on it when I was going through the master's program as heavily as we probably should have. I think we're good at coming up with options, but really addressing these topics, maybe not as comfortable with. I don't know what your background is on that or what you've been dealing with your students, but what are your thoughts on that?
Well, I think it's certainly something that needs to be talked about, and it's in some of the standards. So the students who are coming through now should be getting that information. I think, there's a couple of issues or challenges there. It may be based on how educators feel comfortable talking about it, because they may not have a great understanding of the concept and to be able to, relay that to students, and so they can understand the capacity in which athletic trainers have the ability to affect some of the social determinants of health, or really the part that we play with our patients, even if you don't really change the greater social determinants of health that exists for people. People should be coming along now through the process of learning and understanding those concepts. But again, also all of our curriculums are definitely packed with a lot of content. And I think there has to be a certain way that you incorporate it in a way that it's not siloed. And I think when you do that, then students have a greater understanding of it and they can apply it better in their future practice.
Yeah. So you just brought up a great point of how much we have in the curriculum right now. How are you addressing this and fitting it into teaching the students about these different variables within an athlete's health?
Yeah. So I think initially you need to kind of define some of the terms and what the social determinants of health actually are. And of course, there are, these non-medical system-wide structural factors and components that affect the way people receive and get health care and have health outcomes. So there's certain things that, we don't see on a daily basis when our interactions with an athlete, but there's some greater things that affect athletes or patients or our clients that certainly would help in the healing process. And so to answer your question, I believe the way that we do it is, even if I teach an evaluation class, and so I'm teaching an evaluation about a knee or an ankle, then when we go to the process of how do you make this person better, then there needs to be some questions asked to the patient, to the athlete, about what are some barriers, what are some challenges, what are some things that may prevent you from actually doing the best that you possibly can when it comes to performing this rehabilitation program or accessing the things that we need to get done in order to make you better. It's, you don't need to be someone who's a social activist. I think that's, as soon as you hear the term, then people are like, okay, hey, wait a minute, I don't want to do that. That's not in my lane, or that's something that's different. But I think when you look at it from a perspective of these are the factors that potentially affect how a patient can get better, then it falls in our lane and it falls in some of the things that we need to do. So if you put that into the curriculum, say, hey, how do we're going to teach you about 2 sets of 10 and 3 sets of 8, but are there some other things outside of that that we certainly need to take care of, or at least investigate, so that our patients can get better, feel better, and they end up being no different. And I hope certain social determinants of health kind of grow into the aspect of the way we see sleep and the way we see nutrition and the way we see mental health now in our care.
Yeah. Well, it seems like it's a very politically charged word when you bring it up. I mean, I think there are a lot of factors that make it difficult for some people to achieve what they need to get done with their health ultimately. So while you were talking about that, I think it's important getting it in the evaluation. But are there other ways to start trying to catch on to these social determinants before somebody even gets injured? Should we start incorporating questions into our pre-participation exams or anything, you think? Or do you think it's so dynamic that it would be really hard to capture?
No, I think there are actually several pre-participation kind of surveys that you could add to that exam, which ask students about, or ask patients, if you will, about some of these social determinants and how it's currently affecting them. And, when I worked in the collegiate setting, we started doing that by giving them a form where we asked them about their mental health. Right. So we were asking people about, what is your mental health status? And maybe are there some resources that we need to get you? Well, then you can do the same thing at the beginning of a pre-participation examination and ask people about some of the social determinants of health. You can ask them about where they live and how they live, and whether there's a food desert, and what kind of insurance they have, and all of these other pieces, which can potentially, if you use it from a pre-participation perspective, you can try to help prevent some injuries or help prevent some challenges that students, patients, clients may be experiencing down the road.
So before we get fully into this topic, what would you define social determinants of health in your own words, just so that we make sure we have a common understanding?
Yes, absolutely. So the social determinants of health are typically these non-medical, and we could say structural or system-wide factors that affect people and how they are able to access healthcare, and contribute to how healthcare outcomes. And so there's actually 5 social determinants of health. They're actually spaced out. And so I'll just tell you what they are. One is economic stability. The next one is education access and quality. There's healthcare access and quality. And then there's neighborhood and built environment and social and community contact. So really, they're things that we don't necessarily see on a daily basis. Like when you look at your patient, you don't see kind of their neighborhood. You see them. And so athletic trainers typically don't see these concepts when we're looking or talking to a patient. So we need to ask them about the social determinants of health.
So you've been contributing to the profession of athletic training for a few years now. When did you first notice that social factors were impacting your athletes and needed to start being addressed in your care?
Certainly. So I think I was a college athletic trainer, I'm head athletic trainer, and I worked men's basketball and had a number of athletes who came to the team. And certainly because I was managing the department, realized that some of them didn't have insurance just in general, right? So the university required people to have insurance. So we needed to create some process there. And then we would have some of those same athletes not have insurance. They would be taking extra food from the food that was offered for athletes back home, and found out from some of the coaches that that particular athlete didn't have a great home stable situation, or was taking care of siblings because parents were not around, or had some athletes who we came back from a break, and it was like, well, where is this person? We're like, well, the coach had to go get them because they didn't have anyone to come pick them up and bring them to college. So even when you get to a collegiate level, there's still maybe patients and athletes who are experiencing things that they live in their world, and those things subsequently may affect them in their care. And so some of these same athletes, I found out that they were underweight, and when it comes to actually getting them better, that becomes a challenge, or don't have a lot of good, healthy nutrition at their access. And so once, maybe the dining hall was closed and now they needed to have food at home, and that was not something that they could afford to do. So that's when I kind of really learned about some of the really social aspects related to taking care of athletes.
Yeah. So you talked about the coaches providing transportation. I guess since there's so many variables in the mix, why do you think athletic trainers overlook these social determinants sometimes? And do you think they're involved in every social determinant or need to be?
Well, I think they probably may not. Some of them are certainly pieces that they cannot really affect. They're just they're, again, like I said, they're really structural. And we can, I can give you a few examples that really athletic trainers may not be able to really change. Like, for instance, the one that's the category of neighborhood and built environment. That really talks about like the neighborhood in which people work and live in. And so the kind of example I always give to students is, there's certain neighborhoods in which you see people running and jogging, right, and being healthy, and enjoying the open spaces and the green areas. And so does that contribute to their overall social health? Yeah. And does that contribute to their overall just general health of getting outside and experiencing the world? Absolutely. But you can imagine that there's probably some folks who live in neighborhoods where going out to take a run is probably not a safe situation, or that's not something that community does. And so in that respect, athletic trainers may not be able to change those. But I think athletic trainers generally don't assess these because, again, they're not something that we see on a daily basis. We see the injury, we see some of the other factors like swelling and ecchymosis and, instability. And so we're trying to address some of those things. But really, the social determinants of health are these factors that influence and affect the patient before they even get to us, whether they have good food at home, or whether there is an actual grocery store near their house for them to get fresh vegetables and be able to eat well, opposed to a lot of fast food chains, or whether the neighborhood is well, whether folks at home have employment, and therefore leading to having the ability to have insurance and having good insurance. And even if you had employment, and even if you had great insurance, then maybe in your neighborhood, you don't have access to healthcare. Maybe there's a public hospital somewhere close by which takes care of the public needs, but is there a specialist? Right? Is
Mhm.
there an ophthalmologist? Is there there's probably, and there isn't an ankle orthopedist who lives in that particular world. And so that can potentially affect the way people receive healthcare.
Yeah. So you mentioned the five domains. Where would cultural competence come into that? Or would that not necessarily be social determinants?
Well, cultural competence is really people's understanding of a person's patient values. So not necessarily it exists in there, but not necessarily in the specific 5 domains that have been outlined in the social determinants of health. The cultural competencies, your ability to understand or your ability to ask, and some people have moved more towards the cultural humility, to ask a patient about their values, to ask them about what's important to them, because we can't really teach, and no one has the capacity to learn and know all, right? And so if we talk to each individual patient from a cultural humility standpoint, and we find out what's important to you, then we can kind of help address you. So it surrounds the topic, but it's not one of the actual 5 domains.
Okay, just wanted to clear that up. But in your opinion, how does an athletic training department create a system level change to address these social determinants and provide better care?
Yeah, so I think there's several things that you can do. I think we can start out with, as we discussed earlier, if there are social determinants surveys, then you can add that to your pre-participation evaluation. And if you get some information from that, you may be able to sit down and talk to the patient about some of the needs that they have in order to make sure that they're getting everything that they need, either in the prevention mode to prevent people from having injuries, or prevent them from being sick, or prevent them from not having the resources that they need. Or once an athlete or patient gets injured or sick, then I think when you're having that first evaluation, that first conversation, or you're creating a plan, then you could take out that same sheet, or even if it's just something that you kind of have in your back pocket, memorized, understanding like what are some of the barriers do you think may prevent you from being able to be successful in this rehab program? Or what are some resources that you think we can provide you in order to make sure we get this done? Or do you see any challenges? Those are all questions that you can ask a patient at the end of a evaluation to see, are there some food issues that they don't have? Or maybe it's transportation, right? So maybe, we could easily say that if you worked in a clinic, that patient A is not concerned about their health care because they keep missing appointments, right? Or they keep being late. But if we understood that they're taking the city bus to get to your clinic, and they have to take a train and to get to your clinic, and those things run on certain schedules, then now they're not necessarily this delinquent or late person, but they're someone who are relying on the system, and the system is not really conformed to make sure that they get there on that specific time, right? So it's just us really having some grace for people. So I think if we talk about something during the pre-participation or the pre-evaluation in which we examine folks, if some people have some challenges even after injuries, that's something we can talk about. But again, it's also about resources. You don't have to be the actual person who's seeking to change the world, which most of us like to do. But we certainly can just have resources either in our area, in our athletic department, to assist patients.
In sports medicine, we talk a lot about recovery, but not all recovery tools are created equal. Mark Pro isn't just another muscle stim unit. It's a recovery technology trusted by elite athletes, athletic trainers, and rehab professionals. Whether you're grinding through tournaments, back-to-back practices, or long clinic days, Mark Pro helps your muscles recover faster, perform better, and feel fresher tomorrow. By improving muscle activation and promoting natural circulation, Mark Pro clears out fatigue and accelerates your body's natural healing without soreness or downtime. Use Mark Pro to stay ahead of fatigue and keep performance consistent, because in sports medicine, recovery is performance. Head to markpro.com and use the code TOTHEBONE for an exclusive listener discount. That's to the bone at markpro.com. Mark Pro, the best in recovery. Hey friends, quick break to talk about something that's changing the game in sports medicine: red light therapy. We're talking real science and results. There are over 4,000 research papers showing how light can help with inflammation, pain, tissue healing, swelling, and musculoskeletal conditions. The team at Fringe took that research and created red light therapy tools designed by rehab experts and sports medicine professionals, built to deliver light directly to the tissues that need it most, promoting healing from the inside out. And get this, no wires, no EMF, no flicker, and absolutely no bad vibes. Whether you're running a clinic, working in an athletic training room, or recovering at home, these tools are a game changer for performance and recovery. Check them out at fringeheals.com and get 10% off with the code TOTHEBONE10. That's to the bone 10 for 10% off.
Yeah. Well, that's what I was thinking about when you're talking was if somebody was on a campus, a high school or college, do you have any recommendations on other departments that can help with these situations, or even in the public health, if you're working in a hospital or something? What kind of resources can you provide to these patients so that they can help better manage these determinants ultimately?
Absolutely. So I think, some of those are the resources that you could potentially currently use, whether it be the school nurse, counselors that are at the high school in athletic departments now. Of course, they have, the academic advisor. So, I wasn't in academics, but I was the athletic trainer. And so I'd go up and talk to the academic advisor and how are people with their grades?
Mm-hmm.
And I think, and now we see that the NCAA and most colleges and universities have moved towards actually having a mental health care provider, right? So if you have kind of this care team that can help and assist some of your athletes and some of the things that they need, there's certainly some things you could do. So counselors, mental health professionals, if you want to reach out into your community, so whether that be like a food bank, because there's a possibility that there's some food insecurity that students have. You think about a high school and maybe students are coming to school and they haven't eaten breakfast, right? And maybe there's an early morning practice. And so how do you help them have some nutrition in order to actually perform the high school practices that you're supervising, that, you're providing some care for? Maybe, the high school can talk to a food bank, or maybe someone can have something donated, or even maybe the coach or the athletic department has money in their budget to buy sandwiches or things of that nature to provide food or provide some resources. So, some of the standard things that we, currently have: social workers, mental health professionals, coaches, and athletic department folks, but even things in your community like food banks, social work and social care folks are certainly, would contribute to that. Even, the nurses and the physicians that you work with, who, your team physician, can you work with your team physician and get this student athlete a free x-ray this time? Right. Because they can't afford it because they don't have insurance. And that's a trade-off that you have with your system. So there's a lot of people that you can work with because you don't have to be the end-all person to do it.
Yeah. Yeah, it's just we're juggling so much. I was wondering, how do you manage that, especially since there's a lot of mental health implications that go with it. I wouldn't think that I would be the one to help counsel them through that. And that's why I wanted to see what resources you could come up with.
Absolutely. Yeah, absolutely. And we're busy, right? Really busy folks trying to manage all the things that are, let's say, out of our control.
Mm-hmm.
Schedules and, everybody who just kind of walks in the door and needs help we become the epicenter and resource center for the entire high school or for the entire college, and every coach, every daughter or son of a coach who needs something, and we've all been there. So certainly there's other outside resources that we can direct people to, but understand that, all of us would probably say that we're looking to perform this holistic care model, right?
Mm-hmm.
Like if you want to perform this holistic care model in which you take care of people in a whole way. And this is just another part of the whole that really hasn't been exposed that we can contribute to the health care of our patients.
Yeah. Well, so I've known about this concept. I haven't seen a lot of continuing education on it specifically. Do you have any resources or even ideas of professional skills that can help address this within an athletic training room?
Sure. So, there's been a few, there's definitely been several articles in athletic training related literature. And I tend to see there's always one or two presentations that are done at the major conferences related to the social determinants of health. But as we talked about, as soon as you say social, it kind of, some folks kind of take it to this, it's politically minded and don't necessarily see it as this kind of patient value, holistic care process. And so then that doesn't that doesn't end up being the talk that you go to or the session that you go to. I can say I've seen it because I not necessarily I look for it or I know what it is, and so I'm not afraid to go to those types of resources. But yeah, certainly I could share some resources of some of those questionnaires and then some athletic training related literature that talks about the social determinants of health, kind of really giving the basics about what it is and how we can incorporate it into our practice. It's out there. It does exist. It's certainly probably not as many as the ankle or knee evaluation sessions, but there is some out there in order to assist athlete training.
Yeah. So, do you this is kind of an odd question, but while we were talking about it, I do think that athletes have an advantage with their resources to athletic trainers. Do you think they have a unique advantage to addressing social determinants because how closely we work with them day to day than possibly the public patient demographic?
Absolutely. I think because we have such great relationships with our patients, and most athlete trainers, at least in the traditional setting, see patients on a daily, multiple times per week, we develop those relationships, right? And we kind of pride ourselves on that ability in our profession to develop relationships and see people and know them and know things about their lives and how we can potentially help them. And so we certainly have a big advantage, not only with having the accessibility to them, but also having that relationship where, maybe someone may not fill out the initial social determinants of health questionnaire at the pre-participation physical and say, I live in a food desert or I don't have insurance. But as you develop a relationship with them and you see them on the bus every day, you see them at practice every day, and you get to know who they are and some of the things that they really need in order to be successful, then I think we have this huge advantage to be able to intervene and provide care for them. And especially when, those who are in the traditional setting of the secondary setting, your high school, your secondary school is like in that neighborhood, right? And so the neighborhood, the demographics, the socioeconomic status of the kids who you see every day. And so then you have a greater ability to affect some of those things. So, yes, absolutely. Those who are in a traditional setting have a bigger advantage than those who are maybe at a clinic or a hospital. But still, they have an opportunity to ask those questions at the end of the evaluation, to do it before the evaluation begins and say, what are some barriers? Or if we send you to physical therapy, like say you go to a clinic, if we send you to a rehabilitation clinic, like what are some barriers? Will you be able to get there 3 days a week? Will you be
Mhm.
able to pay for the copay? And sometimes those are not really great, fun conversations for us to have, and we may feel not necessarily good about that. I've known some places where they'll say, what, we're sending in one of our care professionals, whatever you want to call it, and that person is going to ask you some questions to make sure that you have the ability to pay the bill, access those things. And if you don't, then maybe we can set you up on a plan, all of those things. So if we don't want to be the person in some of those larger healthcare settings, then there should be someone who has that ability to talk and have conversations about how you're going to get to this place.
Mhm.
What physical therapy are you going to go to, or what rehabilitation clinic are you going to go to and see, and are you going to be able to come back and for a checkup? All of those things I think are important, but we just need to become more comfortable with accessing that information.
Yeah. So, if you had a crystal ball, how do you see awareness of social determinants shaping the future of athletic training practice and policy?
So certainly, I think they're important aspects to how people live and work and how they experience the world for our patients. And so subsequently, they end up being challenges or things that we have to manage also. Not necessarily manage on a day to day, but we need to be aware of. I think if I had a crystal ball, I would hope that the social determinants of health would not be politicized and that they would become more of these other holistic medicine aspects of care that we're currently moving into. Like we're moving into more of making sure that people have proper nutrition. And so now at colleges, they're having a bigger training table and a bigger food variety for athletes. And then now they've hired nutritionists right at the major places. The NCAA is basically, I think, mandated that now athletic departments have a mental health professional, right? So now, if you have a mental health professional, you're now looking at the mental aspect, and so maybe there's going to be someone who's going to be able to discuss with patients and athletes about some of their social aspects. And I've known colleges and universities who are like, once the student comes to the university, then we keep them. We keep them here because we can feed them, we can take care of them. But once they go back home, then we're not sure that they're going to have some of those same level of care. They're not going to have the same food. They may not have the same health care. They may not have all of those things. And that's why some universities, don't have students go home for the summer because they can provide. So the crystal ball would be is social determinants kind of moving more towards where nutrition is, where mental health is, where sleep is, because we know that those things affect the overall health of our patients and athletes. And if those things affect it, so can the social determinants of health.
Yeah. So not saying that athletic trainers are super rigid, but what would you say to an athletic trainer that feels that this isn't in their lane and they're not trained to deal with these types of variables in their patient load?
Certainly. So I would say that, we would probably we like to provide the best environment for healing. If we just say, I'm an athletic trainer, I'm providing the best environment for healing, whether that is decreasing swelling, increasing range of motion, all of those things. So if I'm going to help provide the best environment for healing, I also need to be aware of these other aspects that contribute to the healing of a patient. And those aspects, if you will, are things that are not seen. They are whether or not they have food at home, whether or not they have insurance, what is the health literacy. So, do they really understand and comprehend not doing the exercises where it's going to put them?
Mm-hmm.
The safety that they may have trying to just get from home to the school may be an issue or a challenge. So again, I don't think it's totally outside of our scope. There are factors that are going to eventually contribute to the healing of our patients. We all probably want to take this holistic care model where we're looking at all the things that are going to affect the athlete, and we don't have to solve the problem. Just like we understand that the psychosocial or the psychology of it, that we don't all have to be mental health professionals, and we're not, right? So since we're not mental health professionals, what do? We have resources to refer somebody to those resources, those appropriate resources. So not necessarily solving the problem, but sometimes just the identification of it or the
Mm-hmm.
challenge, and then to be able to refer someone to the appropriate resources certainly helps us and would be kind of the place where we need to start.
Yeah. So I'm going to throw you a curveball. So we talk mostly about patients ultimately. If we zoom out and look at athletic training as the profession and the social determinants to being a professional, do you have any thoughts on that? How do we better support our athletic training community?
So athletic trainers, who may have some social determinants of health challenges themselves,
Yeah.
certainly I think education that goes into what's best for us in our lives. I think, again, it's probably another wave that the profession is moving into. And, we kind of start talking about our own self-care, if you will, from the negative, like this is burnout and this is all the things that are happening with burnout. And so Now we need to get to a place where we understand that there's some things that we need just as people so that we can provide better care for our patients, but really just so we can take care of ourselves. So yeah, we are affected by the social determinants of health because most athletic trainers nowadays are going to be master level educated folks. Then we know that, education may not necessarily be the challenge because we've had that education, but we need to know about healthcare and healthcare access. And really, we need to understand that we need to take care of ourselves just as much as we're looking to take care of our athletes. And we need to be in great neighborhoods where we can be out in green spaces, enjoy the world and smell the roses and the fresh air. Certainly the economic stability is a challenge, just with pay. Certainly so many things are coming out with that. And even I believe in programs and athletic training programs, we're starting to educate young professionals about the jobs that you should be taking or your value. And if they don't take those jobs, then of course, some of those jobs are going to have to raise the level of pay in which they offer to people. And then, kind of one of the last areas in the social determinants of health is the social and community context. I have students that run the gamut, and there's some who just absolutely love the athletic training room and will spend more hours in it than I really would allow them to. And it's like, listen, you need to go out and for your maturation, not only as a student, but as a future professional, like you need some hobbies. You need some other things that you can get involved in to expand your social and community world so that you can be a healthy individual just as we take care of and we are invested in the lives of other people. So certainly we need to assess and look at where we are when it comes to our own personal social determinants of health. We are fairly educated people. And so, that may not be the lane that we need to move in, but certainly understanding how we better take care of ourselves is certainly important.
You work hard. You train hard. You take care of everyone else. But when was the last time you treated yourself? That's where Source Soap comes in. Created by athletes for athletes, Source Soap is an all-natural recovery soap that helps wash away soreness, inflammation, and fatigue. With ingredients like peppermint, eucalyptus, and activated charcoal, it's basically self-care disguised as a shower. Whether it's after a long training session, a tournament weekend, or just a tough day, Source Soap helps you reset, recover, and smell amazing. Because taking care of your body shouldn't stop when you leave the gym. So go ahead, treat yourself. Head to sourcesoap.com and use the code TTB15. That's TTB15 for 15% off your order. Because recovery starts with you.
Raise the bar in 2025. Complete your BOC certification maintenance requirements early. Don't forget that 2025 is a reporting year for athletic trainers. Are you on track to complete your BOC certification maintenance requirements? Find out today by logging into your BOC profile at bocatc.org/BOC360. That's right, it's time, and this year is the year to renew your certification maintenance requirements. Check it out at bocatc.org/BOC360.
Yeah. I think you brought up a great points on the compensation was what I was hoping you'd hit on because that's been a hot topic. And then even just we have kind of this self-dependency on our jobs and we define ourselves as an athletic trainer and we don't usually talk about other aspects of our lives. So I think it's that social determinant of like setting boundaries at work to make sure you're able to achieve that full range of socialization with your family, friends, just outside hobbies like you talked about. It's been interesting talking to a lot of different athletic trainers, especially like at the professional level where they're like, well, this is my life. I don't need hobbies. This is my hobby. And it's like, well, but is it supposed to take 100% of your time? I don't think so at the same time. So it's a very interesting concept ultimately.
Certainly. And I think, when you're in it, you're in it. I worked some time in a professional level, and when I was in it, I was in it. And you, as you said, you define yourself as an athletic trainer, and you become the job. But certainly you're a greater person than that, and you have wants and needs. And even if you don't know what you need to explore, you need to kind of go figure some of those things out. And if it's, even if it's just kind of going, talking to the community relations folks and say, where can I volunteer?
Mm-hmm.
Where can I go do something like that? Where can I get a hobby or something which doesn't, cause me to be an athletic trainer, and I'm not on, like I'm not on the job, and you're certainly taking care of yourself and taking care of your family. So, and the compensation piece is big. We all know that people are leaving the profession or leaving certain settings because of compensation. And, all those things are just the realization we're progressing, and so we're understanding the economic stability that needs to occur for our lives, and it's not just being a alumnus and great fan of this college, university, high school. That's not going to pay the bills.
Yeah.
And so we need to kind of expand our thoughts there so that we can be healthy people. I think we're so focused on helping others
Mm-hmm.
that we kind of shortchange ourselves. And sometimes it's not until we have a challenge that we have to take care of that helps us kind of reset.
Yeah. And distance makes the heart grow fonder, so you need to get that space in there.
Absolutely. Absolutely.
Well, so we hit quite a variety of things. Was there anything that we missed that you want to hit on for social determinants?
Well, I think just the full understanding of that people should have about what they are and what maybe some of the pieces are that are related to it. Education may be the education of parents, or the education of people that our patients live with.
Mm-hmm.
And so if you don't have the proper education, or you don't have health literacy, then you don't understand how important maybe doing some of the things that we think are just natural
Mm-hmm.
need to be done. And we all understand about insurance, because a lot of people are going to be experiencing insurance challenges. But if you don't have insurance, that makes healthcare significantly more difficult. But some of the other pieces that are like very systematic wide related to the social determinants of health, or just the neighborhood, whether there's a food desert and there isn't a great grocery store, and there's just these little kind of stores that sell chips and high carbonated and sugary foods. And so if athletes, patients don't have good access to food, then that's going to affect their ability to be healthy. And if they don't have access to great open spaces, and it's just a lot of the concrete jungle, if you will, then they don't see those things. So maybe they need to be able to see, trees and grass spaces, and to be able to walk outside and exercise. All of those things all contribute to the social determinants of health. And again, if we're going to provide holistic care, then it's an opportunity for us to support some of the factors that affect our patients. So
Yeah. So where was I thinking with that? So HIPAA is a thing, obviously. But with social determinants, trying to bring together a support system, possibly family members, friends, teammates, other coaches, whatever it may need to be, how do you incorporate a support team in a patient that is experiencing hardships and social determinants and the variables and stuff? How do you toe that line?
sure, I think it's no different, and I wouldn't like to make it any different than the other factors that we know influence a patient. So just like if someone is having some mental health challenges, right? So then we would connect them, and we would do, as they call it, the warm handoff to the mental health professional, contact this person, or have that person who is in the school, or is in the university, or is one of the people who are at the clinic, and they come and say, how can we help? And if you direct them to those resources, then they can access those how they feel like they need to. I could assume that certainly especially at the high school and at the college level, there may be the ability to provide, students with food for breakfast, even if it's as like just in their team room, or even here's something to just take home, for you to take home with, so you can eat, or some snacks, or something we can certainly be creative in supplying those who are in need what they need without ostracizing them and making them a spectacle. And we do that certainly with mental health. They go to the mental health professional when it's a good time for them. It's an appointment. It's not anything that we're, telling other people about, but they still get the resources that they need. So maybe they get extra food in their bag, or maybe, they get an opportunity to talk to a specialist, or the coaches, or someone takes them out to some greener pastures, or now it's a trip because, it's the whole community. Like if the football team doesn't see trees and doesn't see green spaces, everybody's in that situation, right? So why don't we play a game in the suburbs and so be able to do that? So those are the things that we can suggest to administration and to other folks. But I think the more that we normalize it, like we have normalized mental health, then it becomes less of a challenge when it comes to assisting folks.
Yeah. Cool. Well, are you doing any talks on this topic anywhere, or do you have any resources you want to point people to?
I'm currently not doing any talks on it. Certainly it's a passion of mine, and I certainly like to talk about it when it comes to my teaching and helping my students learn about that. So there's no talks on the horizon, but you might have given me some ideas to propose some, especially just on a basic level, so the professionals can certainly understand. And I think those who are coming along now will get it. It is a Katie standard that you learn about, the social determinants of health, standard 57. And so students who are in a master's program should be learning about it. As we know, with the meeting that we were both at, there's a group of folks who may not necessarily have all the information. So I could certainly kind of give you some information, and you could post it as some links for folks, whether it be athletic training based or just some things in general about the social determinants of health. You can actually go to the social determinants of health, find themselves are housed in the Department of Health and Human Services for the federal government.
Okay.
And so if you just go into your browser and type in healthy people 2030. And so it's always a project of the government. They've done this a number of years. And so essentially what it is Healthy People 2030 is kind of this aspirational goal of decreasing the social determinants of health. And so they have these statements as, by 2030, we would like to see these things happen. And that's, that happened in there's a 2030 now. Previously, it was Healthy People 2020. Mm-hmm. The aspirations when we got to 2020, but of course now we're almost about 6 years past that. But there you will find the actual information. That is where the social determinants of health is typically housed. Just go in, type in Healthy People 2030, and you'll find the social determinants of health. You may see a video from some of the people, the Surgeon General, someone that talks about what it actually is and some of the components that we're trying to decrease so that everybody can be healthy.
Perfect. Well, any last words?
No, I just thank you for the opportunity and the chance to, talk about this topic, because certainly it's something that needs to be addressed. But again, if we could normalize it and if we could get it into holistic care where we talk about it just like we talk about sleep, nutrition, and mental health, I think we would be doing our patients a big service. And as we know, all of those concepts are not additional responsibilities that we add on to our lives, right? There are things that we've learned to resource out and be able to provide for our patients and our athletes so they can.
Yeah, definitely. Well, thank you so much for being on, and I hope to have you on in the future to talk about some other interesting topics.
Absolutely. It'd be my pleasure. Thank you so much.
Yeah.
That's it for today's episode of To the Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To the Bone podcast is a product of Daly LLC. It's hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep cutting deep.